As we've been following all afternoon, Governor Brown is making face coverings or masks required at indoor public places. If you're just joining us, we wanted to bring you another look at the important details. Starting on Wednesday, Oregonians will be required to wear a face covering in indoor public spaces. This applies to all Oregon counties, not just the original 8 counties previously under a mask requirement. The face coverings must cover your nose and mouth, and the big question is, who's going to enforce it? Well, Governor Brown says the Oregon Occupational Safety and Health Organization, or OSHA, will take the lead. Newswatch 12 has reached out to that organization to learn how they plan to enforce it. At this time, we've not heard back, but we were going to keep asking. Full details on the new face covering rules are on our website at kdrv.com. Earlier this afternoon, we spoke with Dr. Jim Shames. At the top of the hour, you heard him talk about mask requirements. We also spoke about some of the new case trends in our region. What are you seeing in the cases we've had recently in the county? Are we starting to see any trends or any changes in who's getting the virus and how sick those folks might be getting?
Right. Unfortunately, the trends we're seeing are all the things that would be predictive of a problem. People who travel from a high incident part of the country like Arizona or California into our valley, and then having personal parties. The majority of our recent cases are family get-togethers, a party here and a party there, where, one person can come in incubating the disease, go to party, go visit with a family, and all those clusters end up getting infected. So, the unnecessary travel piece, if you're going to be indoors around others, keep your distance, wear a facial covering, wash your hands. Those things are very relevant. They definitely stop the spread of the disease. And when you're asking for what trends are we seeing that people aren't doing that. And so we're seeing a lot of COVID in the last week.
Are those folks ending up in the hospital? Is our hospitalization rate going up at a number that you would expect given the spread of cases in our area?
That's another one of those things that lags behind. People who end up being hospitalized often are in the second and third week of their illness. So I don't think we've seen major numbers. We have seen a few people end up in the hospital, and there was a period of almost, many weeks where we had nobody in the hospital. But I can't say yet whether that's a trend that's going up or not. But, the more cases we have, the more likely it is to occur.